Good day. Welcome. My name is Dr. Sakiba Syed, and I'm the host today for Hudson Health, along with my brother, my co-host, Dr. Amir Syed. Unfortunately, he's not here today at the set because he had symptoms of some side effects of the COVID vaccine. So I'd like to first say hi to Amir and maybe ask him some questions about his side effects.
They weren't very good. They were not good at all. I just felt it was the Pfizer vaccine, which I should have waited for the Moderna vaccine. Much, much better, you know?
I heard some people say the Moderna.
Company, the Pfizer one wasn't. No, I had the complete opposite effect. But thank God, like today is like my second day and I feel really, really good. So back to work tomorrow.
Right. So did you have any fevers, chills? What did you have?
I did have a fever of 100 degrees. I also had a lot of body aches and just a lot of fatigue. But I think one thing that helped me the most was drinking a lot of water, taking 2 Tylenols every 6 hours, and I think that helped me a lot.
So it's a lot of symptomatic relief.
Yes, and I continue taking my zinc, my vitamin D, and my magnesium every day.
So basically,
and the goal is 88 ounces of food a day, and that keeps you very well hydrated, and that's very good for your muscles. Because 80% of our body weight is water.
Water, absolutely. So, and I think that's key, maintaining even before, during, after the vaccination, you have to keep your health, at pristine levels, especially during the pandemic.
Yeah, and Sanjay Gupta wrote that book that I just recently read. It was just amazing about how to keep your mental health up to date. And it's one of the things is like not even doing rigorous exercise, just a brisk walk, maintaining a social community, simple little things like this, eating berries, versus, they say an apple a day keeps a doctor away, but actually eating berries, they do have scientific evidence that helps with neural health.
Absolutely. It's the antioxidants.
Absolutely. And I'm going to wait till we speak to Mike about this. But, and that's sort of a segue into the next segment about mental health, especially during COVID.
It's an honor for us to have these wonderful guests today. I'd like to introduce our first guest. His name is Derek Rapisarda, and he's the president of Bespoke Health. He sent me a little synopsis of what their company does, and I'd like to just read up on it. It was founded to provide better public access to care during the COVID-19 pandemic. The goal is to provide states and local municipalities with a turnkey, tailored vaccine solution that allows a quick deployment of staff and resources to deliver an organized, efficient, and reliable operation. It's an honor for us to have you here. We spoke to Stacy Flanagan from the director at Jersey City. She's amazing, how she orchestrated everything, and I want to really thank her for what a wonderful job she's done, and she's, I think, collaborated with you, and you're going to make our life so much easier. So the stage yours, Derek.
Thank you. Yes, and to your point, Stacy is wonderful, and I think Stacy, her team, and the mayor had the foresight to see that this would be a substantial endeavor to get everyone in Jersey City vaccinated, and I think we're fortunate to work with them and develop a plan that's catered and tailored to Jersey City, and hopefully getting as many people vaccinated as quickly as possible. So,
and I think that's key. There are a lot of people in Jersey City, and so the logistics lie in a couple of factors. One, like I spoke to you about before, is dismissing a lot of unfounded fears So we're going to need your help in disseminating a lot of information. We're doing a lot of education with our patients, but I think the public health awareness really needs to step up its game, and because patients are legitimately scared. And your operation is amazing. What I see and what I read up on is really going to help the city, Jersey City.
Well, I thank you for that. Yes, I agree. I think that, we're working to hopefully, not hopefully, but we're working to partner with a lot of organizations within Jersey City, non-for-profits, religious groups. We're trying to educate the public on what exactly they can expect from the vaccine and what we need from them, because as we spoke about previously, we're not going to get out of this pandemic unless we have a substantial response and substantial turnout from the public. So, yeah.
Right, so we'll be back after a short break.
Newport, the luxury waterfront community on the Hudson River, offers the quality of life you deserve in 10 high-rise rental towers with amenities such as the on-site Newport Path subway, light rail and ferry service, Newport Town Square, 3 playgrounds, dog run, upscale restaurants, retail giants like Sears, JCPenney, Macy's, and Target. Morton Williams Supermarket is just outside your front door. A health and fitness club, spa, skating rink, and medical facilities are also on site. NewportNJ.com. Enjoy the New York skyline from Newport Town Square. Manhattan is just one path stop away or quick ride through the Holland Tunnel. Nursery and private elementary schools all on site. 12-screen movie theater at the Newport Center Mall. Want to visit Newport? Stay at the Westin or Marriott Hotel. Go to NewportNJ.com for details. Newport has luxurious towers, great restaurants, shopping, New York skyline views, schools, playgrounds, a marina and yacht club, gym, spa, fine wine, fine living. It's incredible. It's you. NewportNJ.com. Newport. Live like you want.
You know those times when you need to see the doctor, but you just can't get to the doctor? So where do you go? Go to the App Store, download the Telemed app from RWJ Barnabas Health, and you see the doctor right away. From any mobile device. Whenever you want, wherever you are.
Quality care. No appointment necessary. The doctor is online when you download the Telemed app.
Don't you feel better already?
RWJ Barnabas Health. Let's be healthy together.
Hi, my name is Dr. Sakiba Syed, here for Hudson Health, along with my brother, my co-host, Dr. Amir Syed, who's actually calling in for the show. We have a guest today, Mr. Derek Rapisarda, who's the president of Bespoke Health. And he's the person in Jersey City who is going to help us vaccinate all of our residents here in Jersey City. We'd love for him to tell us how he's planning to form the infrastructure and plan this out, as it's an ongoing struggle right now.
Yeah, thank you. So right now we have we Bespoke Health have one pod open at the Bethune Center. We will be rolling out at least 5 additional pods, 1 in each ward, to ensure that we can reach every member of the community. So the pod will act as as obviously the vaccination site for the city, or for that specific ward rather. And what we have seen so far is we hope to be able to start rolling these out very soon. We're waiting on, unfortunately, there's a bit of a supply issue, I think, federally that we're seeing throughout the country right now. But as soon as we can get that figured out, we'll start opening additional sites. Additionally, we're going to have a call center in the very near future that enables residents to call in. The number will be published on Jersey City's COVID. They have a COVID vaccine webpage. So the information will be posted there, but within the near future, we're going to have a call center. People can call in and ask questions, understand appointments. We're still in Zone 1A. So that's residents that are 65 years and older, as well as healthcare workers, fire, and police.
Wonderful.
and hopefully we can start. Yeah,
So my
please.
question is, you're working with the city. Now, will the hospitals also have like some sort of phone number where they can actually give the patients? Maybe we should work in collaboration with a lot of medical clinics. A lot of patients are asking us, doctor, are you going to give us a vaccine, or how is it being managed? So maybe, working with the hospital systems and letting them know that this is the number, and they can disseminate it to their physicians, and then we can actually go ahead and work together with you.
Yes, and that's a good point. So we are working with hospital systems currently. Again, there's a supply issue, so that's not necessarily broadcast at the moment, but it will be very soon, because we're trying to ensure that we're only serving those people in Zone 1A, and that we're not taking people from additional other zones. But in the very near future, hopefully that the supply issue can be corrected and will be better suited to handle the mass of the population.
I think
Derek,
Biden today announced that they were going to increase the allocation to the states by 17%. So that's good news. So that the
fine,
supply
but
is better.
Do you think that the Johnson & Johnson vaccine is going to have a big effect on this? Like, it's almost going to be
I said-
approved, the Johnson & Johnson vaccine?
Yeah, so the Bespoke Health, we're working with the Moderna vaccine currently, and I believe that
Okay.
that's the vaccine that we will be allocated for the entirety of our operation, to ensure
Okay.
that everyone that received their first dose of Moderna is able to get their second dose of Moderna. I do believe that the Johnson & Johnson vaccine will have a substantial impact on supply for other areas, right? Which will then impact Jersey City, because other areas that are not boxed in, or not necessarily boxed in, but haven't already begun that allocation, will be given Johnson & Johnson, which will then free up more Moderna, more Pfizer for those other areas that have that. I believe you said you received the Pfizer vaccine.
I did. The funny thing is that I don't understand that. I spoke to Steve about this on March 4th. And I said, you know what? When I spoke to Stacy, I said, we have 4 huge inlets coming in from New York City, right? So we have the subway system, we have the ferry system, and then we have the bus system. Let's start hitting our masks. It's preventative. Okay? So what's done is done. But I think the COVID, has cost us 500,000 lives in this country, because all the data is 2 weeks behind. But it just shows you the lack of public health in this country. And I think what you're doing is a very noble job, is because, they literally need help. Like, I literally spoke to certain people in the county, and they're like, all right, well, you tell us how to do this. I'm like, this is like a 5,000-page report. It's just structure. It's an organization that you create. It's not something which you can just, overnight just write up like an essay and say.
I agree with you 100%. We're going to have to take a short break right now, and we'll be back. And I really want to thank you, Derek, for everything. We look forward to working with you and helping our residents of Jersey City make sure they get their corona vaccine.
Stevens Jersey City Ford, located right off of NJ 440 North. Across the Hudson Mall is your one-stop for all your automotive needs. Check out Ford's latest models like the 2020 Ford Fusion with its stylish looks and hybrid options, or the unparalleled high-performance 2020 Ford Mustang. The 2020 Ford F-150 Raptor is ready for those rugged off-road terrains with trail control. Need a mid-sized truck for your towing and hauling? The 2020 Ford Ranger will deliver. The 2020 Ford Escape is a luxury SUV that was made for comfort and adventure on the go. Returning is Ford's legendary Bronco, which takes you back to the true meaning of off-roading. They are now available for pre-order in our showroom or on our website. Let us help you find your next vehicle. Stevens Jersey City Ford, 201-432-7272.
Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, Jersey City. Hudson County's only monument maker, serving all faiths and cemeteries. Design, studio, and launch inventory on site. Cemetery inscriptions and custom orders welcome. Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, just south of Secaucus Road. Craftsmanship that will last for all eternity. Burns Brothers, Jersey City, Albert H. Hopper, North Arlington. Visit us on the net. Consumer Carpets, 3408 Kennedy Boulevard in the Jersey City Heights, your one-stop store for residential and commercial floor treatments, carpeting, linoleum, tiles, laminates, hardwood floors, area rugs, remnants, all major brands, all in stock. Free estimates, same-day installation. Consumer Carpets, it's savings, selection, installation. Credit cards and debit cards accepted. Financing available. Consumer Carpets, price to fit your budget, installation to fit your schedule. On the net at consumercarpets.com. Consumer Carpets, Jersey City, 201-792-2712.
Hi, welcome back. I'm Dr. Sakiba Syed for Hudson Health. I'm introducing my co-host, Dr. Amir Syed, who's going to have an interview with Mr. Mark Somerville. Amir?
Hi. I'm sorry I couldn't be on the set today. I was suffering some of the side effects of the COVID vaccine, but I'm much better now and looking forward to going back to work. Mentally, I feel a lot better, but using it as a segue, I know a lot of us have experienced a lot of mental changes, whether they were good or bad or uncomfortable and whatnot. So we have the honor of having Mr. Mark Somerville, who heads up Palisades Medical Center's mental health division, and so which is part of Hackensack. So I'd like to introduce Mark to speak about how depressed after COVID.
Thank you very much for having me on here, and I'm very happy to be part of this. There are many things I could talk about, and please let me know what's helpful to you, but I want to comment on a couple of things. One, that the vaccine itself is something very new to people, and I think there's a lot of fears about the vaccine being rushed out, but our understanding is it is very safe. I happen to be one of the fortunate ones who's been vaccinated also, both of them, and I was blessed to have a very minor response. And I want to remind people that, we think of vaccines as new. We all think of Jonas Salk in about 1953 with the polio vaccine. But the first vaccine was in 1796, only 7 years after George Washington was elected our first president. It was done by Edward Jenner to vaccinate for smallpox. And this is really one of the core issues of health, is getting facts to people in clear, understandable ways, because we're in a very emotional time, and we've never been in a pandemic before in our century, in our lifetimes, where we've had an ongoing crisis. We live in the shadow of the former World Trade Center. And most of us remember, regrettably, very well that Tuesday on September of 2001. But it was an acute event. It ended, and people started to return to normal, as horrible as it was. And that's not been the case. We're at 11 months and counting right now with a pandemic and lives that have been upended. And again, I'm happy to go into it, but tell me what you'd like me to go after, and I'll be happy to speak to it.
No, but it's just sort of having 9/11 every day. I mean,
Okay.
We lost 3,000 people in one day on 9/11, and now we're losing 4,000 people every day, and people have become numb to it. I mean, is this going to lead to like an emotional numbness in society? Like we just don't give a shit anymore, or like how are we going to handle this in the future?
Well, regrettably, you're bringing up the most important points, and the idea that people are feeling beaten down is very real. Charlie Chaplin, the actor and director, had once said that despair is a narcotic. It lulls the mind into indifference, and that's really our greatest enemy. We all grew up believing that the opposite of love is hate, and that's completely untrue. The opposite of love is indifference, not caring, or losing the ability to care. The only people we can really get angry with or hate are the people who are important to us, and hopefully we work that out. The indifference that we're facing right now is highly connected with people no longer having social connections the way they used to. And one of the most important things for people's health, mental health, is the connectedness with other human beings. It's just essential. We learned accidentally in World War II during the bombings of London that Londoners moved their babies, their infants, to orphanages in the countryside, and they had two basic kinds, one for the poor and one for the wealthy. The children in the poor orphanage had everything they needed. Not orphanage, that's the wrong word, but a nursery. The poor ones were still given adequate food, shelter. The ones where the wealthy children had human contact throughout the day. They had much better staffing. What we learned in a horrible accidental experiment is some of the babies in the poor camp started to die from lack of human contact. It was the most clear evidence human beings need human beings. And aside from our physical health, which we're trying to maintain, which is critical in a mind-body balance, is the connectedness with others. And social media is a very tricky realm for that. We've certainly seen it with our children. We're seeing it with ourselves, that there are people in various camps, people who have various beliefs, and it's often very hard to speak with people with whom we don't identify. And we can't go out and see people in a direct way. And this is having a real impact on us. In the past, what we've seen is after a major event such as 9/11 or the Murrah City bombing in Oklahoma City, I believe that was 93, that we saw people start applying for mental health services approximately 6 months after the event. For the first 6 months, people hunkered down. They wanted to take care of themselves, to be safe. And that makes a great deal of sense. It's a very human reaction to have. Now we're in COVID. And every day we're seeing numbers that are scary and meaningful and need our attention. And as you were saying, people are sometimes withdrawing. And this is the danger we're facing now. There is no 6 months. It keeps running. Every day is a new day of stress, a new day of not being able to go to work, worrying about how to pay the bills, worrying about whether we might get COVID or give it to a vulnerable relative. My parents are in their 80s. I haven't been able to visit with them for 11 months on the West Coast, partly because of all these restrictions that are necessary. I agree with the restrictions.
So Mark, real quick, we're going to come to an end and take a short break, but I really do want to touch on that mental health, how it's really affected everybody and how it's crystallized the deficiencies in healthcare that we have right now that's existing and how we need to address those issues. So
Yes,
after
indeed.
this break, we will love to talk to you. Wow, what a great interview. Thank you.
Pen and Pencil Properties, Jersey City. Shaping the workplace with state-of-the-art office spaces that address your company desires. Building residences that define your home environment, adjacent to all modes of transportation with on-site parking available. The right address, the right lease. Call 201-521-9000 or visit online at penandpencilproperties.com. Pen and Pencil Properties, building Jersey City for everyone. Good Friend Self-Storage in North Bergen, New Jersey is a fully climate-controlled facility equipped with state-of-the-art security, packing supplies, a Refer Friend program, and multiple loading docks convenient for commercial use. Located just off of Route 3 at 4301 Tunnelly Avenue, Route 1 and 9. Call 201-867-2444 or visit us on the web today. Good Friend Self-Storage. Let us be your good friend.
Hi, welcome back to our final segment for the Hudson Health for today. My name is Dr. Sakiba Syed, and I'm here with my co-host, Dr. Amir Syed, and we're having the wonderful experience of interviewing Mark Somerville. And Amir, take the stage now.
So Mark Somerville is the head of mental health services at Palisades Medical Center, affiliated with Hackensack. He's such a font of knowledge that I'm just beginning to get to know him. And I don't know how we're going to fit in so much knowledge in such a short period of time. But Mark, what were we talking about? What is going on with the lack of the COVID vaccination campaign?
Okay, in the lack of vaccination, I think to a great degree is people's natural fear, and people need to be engaged and invited into this with a real understanding, both about the safety and the effectiveness of the vaccine. There's a perception that it was rushed, and there's a great deal of rumor that's out there. And the rabbit hole that people go down when they go onto Facebook or social media is one of the most unhelpful things in the world, because it's an echo chamber, meaning that people simply echo the same concept so many times that it sounds true because you've heard it so many times, and that just doesn't work. It's like talking about a flat earth. There's some things that have to be dismissed. So controlling time on social media is a key component for people to start to understand and to start getting facts from trustworthy sources and speaking with people that they know.
I agree. There's so
Especially
much
after-
misinformation out there, and there's a lot of fatigue with information. A lot of people have so much information from so many sources, they're kind of sick and tired, and it's creating anxiety. I really feel a lot of people have never had quote-unquote mental illnesses or disorders, or having thought disorders during this COVID period, and people are coming and talking about it to their physicians now, which they never did before, which is wonderful. That's a great thing. And I think we have all realized to ask people how they're doing, and having that conversation beyond, hi, how are you, is important, especially when we have so much social isolation.
But Mark, like, you know what it me is that, and please, I want to pick your brain on this. All these apps that they're selling online, like Noom and all this other stuff, like for mental health awareness and all this other stuff. Like, is this factual? Is this like genuine? Or are they trying to capitalize on the problem that we're having?
Unfortunately, times of crisis are a great time to make money. And they're a great time for politicians too, from both parties. The more people are scared, the more people make decisions that they wouldn't make otherwise, and would spend money that they wouldn't spend otherwise. And no, most of the things being put forth are not legitimate. We really are going back to our basics with what we know in mental health and in medicine. And we really want people to get clear messages. And I want to toss in that, 15 years ago, the New England Journal of Medicine published an article, I don't have it in front of me. It suggested that more than half of Americans cannot fully understand what's written on a medication bottle, to be properly literate, to understand what's there, even though it's written as plainly as possible. People don't understand a pill bottle that says do not operate heavy machinery means don't drive a car. So we're now tossing facts around, and a lot of people aren't grasping them clearly. And as you were saying, it's not just fatigue, it becomes avoidance. It gives me a headache. I don't want to hear this anymore. I don't want to hear people yelling at me, telling me I'm stupid or anything else. So just clear, basic facts are the most important thing. Hammering away at a person that they're wrong will only make them defensive and pull back and not listen.
So even creating things like, bioaptic machinery, like where, like I was alluding to during the break, like, you put on a sticker and it'll monitor your pulse and temperature and document. Doesn't that make people more stupid? I mean, aren't you like just dumbing them down?
I think it misses the point. People know themselves, and that's one of our greatest resources is people's own reactions to themselves. People have a good sense of when they're doing well and when they're not. And we want to engage people to be better understanding of what they're going through. You take the pain and anxiety that people experience at a time like this, and we treat those as something bad, when in fact it's a communication, either from our feelings or from our bodies, that we need to change, we need to do something. God knows I need to lose weight, and my knees started hurting me a few years ago. I could have taken a painkiller, my knees would get worse. Instead, I need to lose weight and determine how I live my life differently, and the pain goes away. When your car's not working, you don't paint it a new color, you fix the engine. And our engines are telling us that something's not working well. That's a little too crude an example, but you get what I mean. We're trying to create balance with people.
And I think that's key. For me, depression is so important. When you have diabetics, for example, and you have depression, and a depressed diabetic, they're not going to check their sugar. They're not going to take their medications. They're not going to watch their blood sugar fluctuations. So now we have two problems instead of one. Mental health is a real big issue, and I think it's increased exponentially. And we need all resources available. And I agree, engagement is extremely important. It's a pleasure to have had you.
My biggest issue is, before we end this segment, which I think is very important for all our people to listen to, is that I don't know who to refer to. Like, who do I send my patients to for psychiatric services? Jersey Medical Center has a psych ER. I don't know what the follow-up is. I don't know who to refer to. Like, one colleague of mine who I'm pretty sure you knew, Dr. Delacruz, he passed away due to COVID. And, we have a lack of psychiatrists.
We do, and regrettably, your method of payment in the United States, since we still have private health care, determines where you go. I can't decide whether to accept your insurance. Your insurance decides whether to accept
Right.
me. And
That's,
for
that's
that
key.
reason, regrettably, you have to go through, including Medicaid. If you have a Medicaid plan that is consigned to certain hospitals and Palisades isn't included in that, then they won't cover you and you would become self-pay. So I think it's very frustrating. There's a lot of education needed for people, but the most direct message is please call the number on your card, whether it's a Medicaid card or a private insurance card, because that's going to be where you start. But shop. My God, we will go to 3 gas stations to get the cheapest price, but people won't think to go to more than one clinician for mental
Very
health,
true.
somehow believing the first person is where they have to stay. If it's not a good match, go someplace else. I think there's a lack of Spanish speaking. I'm going to self-promote that the staff who work here, 91% are bicultural, bilingual persons in Spanish and English, so that we have no barriers with the people with whom we interact. But I don't think that's a typical ratio in the region.
That's not.
I think this is
It
key,
requires
you know, call the number behind your insurance. And if you don't have insurance, I know the City of Jersey City has a number on their website that does give you options of where you can call for mental health hotlines. I really want to thank our wonderful guests. I wish we had more time. Mr. Mark Somerville, thank you so much. Derek Rapisarda,
Derek,
thank you so much. You
Mark,
guys were amazing. We wish you all the best, and we're definitely going to have you guys back for more one-on-one banter and some great discussions.
Absolutely.
I just want to give you one quick quote. It comes from the Frenchman
Please.
Marcel Proust. Happiness is beneficial for the body, but it is grief that develops the powers of the mind. Ironically, this is a time when a great number of people are going to grow and learn about themselves and their family, and there can be a great deal of positives coming out of it, and it is difficult.
Absolutely. 100%.
Thank you so much. We appreciate that. Thank you.
Thank you for having me
Good
on.
evening. This was a wonderful, wonderful segment, a lot of information. Again, my name is Dr. Sakiba Syed, and I'm here with my brother, Dr. Amir Syed. Looking forward to the next episode of Hudson Health with Amir, God willing, next to me. And we'll have a
We
wonderful...
will bring you more exciting and more interesting topics, more relevant day to day, things that can help you with your health, preventive medicine, and
understanding
major-
yourself better, you know?
A lot of people.
We just want you to know that we're here for you. Thank you, and have a great night.
Thank you.